Okay, welcome back, everyone. Just wanted to touch up just a little bit on the evaluation of kidney function. Most of us, when you've gone to the doctor, they'll have you urinate in a little cup, and we're testing for certain things. It's called a urine analysis. So, a urine analysis, we're checking for certain abnormalities, but we can look at albumin, glucose, red blood cells, ketones, even microbes and bacteria, right? Urinate into a cup. We take a dipstick, we dip it in here, and we compare it to our charts, or we run it through a small little computer system, as I do in my office, to get a nice print up of what's showing. But if you're doing it old school, you would compare the strip, and you'll see we can look at leukocytes, we can look at nitrites, we can look at protein, we can look at pH, we can see if there's blood, we can look at specific gravity, ketones, glucose, just a bunch of things that we're looking for. And each thing that we're looking for, we don't look for at the exact same time. There's a specific reading time for different things. So we would check glucose at about 30 seconds. We can check for ketones at 40 seconds. Protein shouldn't be looked at, and pH shouldn't be looked at, and blood shouldn't be looked at till about a minute, right? It's about 60 seconds for those. And we look at the white blood cells after the 2-minute mark. So if you look at something too soon, you can get these false readings. So understanding the time references for each is really important. And of course, you don't have to remember these, just letting you know that one day it's important to do this. You have to read them at the right time. So when we look for pH, pH can pick up things like, metabolic acidosis or alkalosis, or respiratory alkalosis or acidosis. It can pick up defects in the nephron at the renal tubular region. If there's proteins that are detected, proteins are great for assessing to see if there's any glomerulus damage. It's good for multiple myeloma, which is a type of cancer. It picks up preeclampsia during pregnancy. We're looking at glucose for diabetes evaluation. If we're looking at ketones, this could be seen with diabetics or diabetic ketoacidosis. It can also be seen if someone's doing intermittent fasting or they're starving themselves and the body starts giving off the byproduct of fat metabolism, which is called ketones. When people are on a ketogenic diet, they buy these urine strips and they're checking to see if they're in a state of ketosis, if ketones show up. If bilirubin show up, there could be liver issues. If nitrites show up, there could be some cystitis or pyelonephritis. For specific gravity, it's looking at hydration levels or dehydration levels. If we're looking at leukocytes, that's a great assessment for urinary tract infections and screenings for different types of culture specimens. But the two biggies, besides the urine test for kidney function, is looking at blood urea nitrogen, BUN, which measures the level of nitrogen in the blood, which is part of urea, which is from the breakdown of proteins. So on blood tests, there is a specific range for BUN, and if it's out of range, it is a red flag for kidney issues. The other is creatine or creatinine. It's another test. It's a measurement of plasma creatinine, which is a result from the breakdown or catabolism of creatine phosphate in skeletal muscle. Okay, so if there is creatinine that's showing up, then there is a degree of some skeletal muscle breakdown. Okay, and if the skeletal muscle breaks down, you're going to have protein that's going to be passing through. And we don't want proteins to be passing through into the urine. We don't want those large proteins to pass.